I got a real charge out of that one. Right? You got that? Come on, Mr. Yoon. I got a real charge out of charge. Right? Okay. All right. All right. Thank you again, Kevin. Now we're going to bring up EVA Health with Hanna and Saurabh Vyas. Good? Was that right? All right.
All
Woo.
right.
Thank
Come
you,
on
Laurie.
up, guys.
Hey, good morning. All right, slides are up, mics is on. Good morning, everyone. And Laurie is right, definitely a lovely crowd. So I'm Dr. Hanna and and we're here with Dr. Saurabh Vyas. And we're going to be talking about kind of a next-gen community-led caregiving ecosystem. Before we get started, wanted to bring up the team slide, right? I always talk to my wife and talk about how blessed we are, right? In terms of being able to bring on board such an amazing team, diverse in experience. And as you see here, we have folks from cognitive aging scientists, medical professionals, IT professionals, and we all come together to solve and to help redefine the care experience at home, right? Starting with dementia care. So a little bit about dementia care, that's evolving into a public health crisis. You have millions of families struggling on a daily basis to care for their loved one. The number of dementia patients, it's going to increase by 50% in the next 10 years by 2030. Right? 2/3 of these families are burnt out, right? So, and also the ratio, the ratio from caregiver to patient, and that's sharply decreasing, right, as you see in the previous slide. So in terms of the current problem and trying to dive down and really understand what's happening at the front line, right? Families are struggling on a daily basis, to manage care, but also the interaction with providers is super limited, right? On an average, and I'm sure all of you have been to a provider, it's 8 to 10 minutes. Right, and at the end of these interaction, right, if you can find the right provider, if you're dealing with someone with dementia, that interaction, like I said, 8 to 10 minutes, only left you with a lot of paperwork for you to figure out what's going on, right? And another piece, what's happening, which makes it stressful, it's really finding the appropriate help. Right? Your clinicians only kind of give you some clinical guidance, right? But a lot of it, you need a lot of guidance and a lot of support while you're at home. And the best care happens at home. And 90% of dementia patients, they live in the community. So as we take our solution, right, wouldn't it be nice, right, great, to really have a solution that truly understands your needs as a family, but also as a patient, take into account those specific needs and bring the right support system, right, for you to better care for that loved one. And that's exactly what we're working on at EVA Health, right? Creating a personalized ecosystem to bring you the right support at the right time. And what does that mean in terms of a product, right? We're starting with our platform, EVA 360. First is really continuing that conversation after the clinician visit, right? Bringing you the right information, the right instructions, so you stay up to date on the latest, to have the latest information, and also any breakthroughs that tackles or shed light rather on the issue that you're facing. Day to day, I know is a big problem. How do you bring the right content, the right information, the right alerts, right, to help the family, to guide the family on their day-to-days? And third, and when I say community-led, how do you bring the right folks that are at the community level? So it's not just the provider, but what about some of the services organizations, some nonprofit that are providing help, right? But sometimes there's a disconnect, right? You have the family over there, and you have those services over there. EVA is about bringing and creating those connection points between the services that are needed and those families that are in need of the services. So, now you might say, and we're going to transition to Saurabh here. And one thing I wanted to mention too, we ran out of colors here, so apologies for that. But wanted to give you a glimpse on our vision with LG, right? What is going to be that ecosystem? How do we marry the two together and create something better?
So with LG, we can actually turbocharge the smart caregiving experience at home and allow that better continuity of care. Now imagine, usually what happens is everything is passive monitoring. Things are tracked, such as falls at home after something happens, not before, not before it is actually going to happen in general. There's no active monitoring. Now, imagine replacing that with something which not only actively monitors about the risk and potential downsides of something happening, changes in behavioral or activity patterns on a daily basis, as well as potentially provides you the guidance that you need to what to do with it, with that data that is being collected by a variety of platforms. So with the LG, this is what we are envisioning as families can now access potentially the ThinQ devices. They can access EVA and some of our partners through these interfaces that they are more familiar with. Take your TV, take your fridge, take your stuff, connect them with the EVA platform. Combined with our Wi-Fi sensing partners and Wi-Fi sensing enabled routers, we can actually monitor the daily activity patterns, not just falls, by the way, but also near falls in many cases. We can also monitor for various changes in their bathroom habits, activity patterns when it comes to like longer sleep times and whatnot. All of these are very critical parameters in helping the clinicians understand what is starting to go wrong with that person, even if things have not happened ahead of time. And this may lead to help them kind of make changes to the care plan, whether it is changing the dosing of a particular medication or instituting a particular exercise in the care plan and so on. And this actually can also help guide, if you can go back one slide, please.
Oh, sorry.
This can also actually help guide the patient on their day-to-day activities, and happy to chat more about it later as well. Next one. And we are enabling this with a couple of different business models. So we have the direct-to-consumer approach, where we are trying to keep the EVA 360 as well as this one as accessible as possible, taking into account the neighborhood needs as well as socioeconomic status. And then also we are starting to partner already with value-based healthcare systems and health plans in that case as well. We have a large market size in that. Definitely with LG, you are looking at significantly expanding that, given the connected devices and the potential for them to reaching not just dementia patients, but also the elder senior market in general, particularly those with mild cognitive impairment. Just want to quickly close out on the competitors as well. What they're missing is that focus on the family and the understanding that the families play a critical role, and the understanding that guidance is more important than just pure services or data, especially since not everyone can afford that 24/7 care. And how do you reduce that barriers to entry as well? I think with that, we can start with the questions, and happy to kind of give a little bit more flavors as well.
All right. I think I just dealt with this with a 93-year-old father, and so it's a lot of work, and it's costly, to your point. And the craziest thing is it's also predatory. Unfortunately, the marketplace knows that you don't have any other options, so they'll charge whatever. I guess my big question is, first of all, I love the connected device piece because that's the big thing. Did he just use the toaster? Like, that's just all I need to know today. But do you think that is the DTC model going to be the bigger model, or I feel like that is, but I'm just curious, of those three that you put up, which is you think the biggest opportunity?
Go ahead.
So both are actually important. So we have talked to a lot of family caregivers, particularly the more well-to-do ones, who are actually willing to pay out of pocket significant sums of money for this active monitoring. Even people who are from relatively middle-class backgrounds are actually more than willing to pay, because it gives them some time to focus on their errands, for their me time, and even at work, even if it is like 4 to 6 hours in a day at that time. However, having said that, one of our understanding is how do we make it even more high touch? So we have a lot of other service elements built in as well as we grow, and for those models to be more cost effective, as well as kind of reduce the barriers to to access to everyone. We are partnering also with health plans, particularly Medicare Advantage and others, and the value-based systems, because that can enable this for free for a lot of the families as well.
Any questions? I actually have a lot of questions, but I want to give a chance to other judges here.
Yeah, just a question on the team. I saw the slide, it was pretty quick, but
Sure.
What is your next key hire and why?
One of our key hires is actually an AI person or an AI engineer who can double up as a CTO. We are right now talking to actually 2 engineers as we speak.
Well, make it 3.
Yeah, make it 3. And one of the other importance is, like, you will notice that we are very focused on diversity of all kinds and shapes. So we are trying to identify the right person who complements this co-founding team in the right way, preferably a woman engineer, if we can find one.
And also we're looking at, we have to be global in terms of our approach as well. So we're looking at folks overseas as well.
All right.
Thank you.
Thank you.
Thank you.
Great. Yeah.
Great job.